Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. It has been an unforgiving cycle for local small businesses. Open, close, open with restrictions, close down again. Well, this week, the stay-at-home order ended, allowing some businesses to get back to work. KPBS reporter John Carroll caught up with a few who have weathered the storm.
Now we start over again.
Jeff Kasha owns Rudford's restaurant in North Park. He can now return to serving customers outdoors, but he's not as happy as you might think, and that's because of what's happened that's led up to this point.
When you own a restaurant, and they shut you down, your inventory goes down, and you have two choices: give it away or throw it away. So that's what we do 7 times.
Kasha would have been ready to go with a tent on what was part of his parking lot, but Mother Nature dealt a cruel blow on Monday. The tent is now a crumpled pile of tarp.
There's water, there's poles, thank God nobody was in there. Thank God it was at, 4 o'clock in the morning.
Kasha is fortunate in that Rudford's has been around a long time with a lot of loyal customers.
We miss seeing our guests dine on premises.
Stephen Torres co-owns Pop Pie Company in University Heights. Though he's happy that customers will soon be able to return to this street dining space, he's been luckier than most because of his business model.
Takeout was big for us from the get-go. Takeout, delivery.
Torres didn't have to lay off any of his employees. Even so, he says the last 10 months have been difficult.
It's been a challenge for all of us, physically, mentally, emotionally.
Then there are the businesses that have been closed completely since the stay-at-home order was issued in late November of last year. Here at London Nail Spa in Point Loma, the last time they were open for business, they were doing it in a tent here outside. But now, with the stay-at-home order lifted and the required safety modifications in place, they are ready to welcome back customers.
I'm so happy. I feel relief.
But for spa owner Cindy Fan, operating like this isn't anything like it was pre-pandemic. She has to space appointments out further apart, meaning less customers overall. And her hope for the future is tempered by what she's been through.
We're still in the bubble, but we try hard. We, like everybody, I think.
For these San Diego business owners and so many thousands more like them, things are now a little better, even as the COVID roller coaster ride rolls on. John Carroll, KPBS News.
And we will be showcasing our local reports throughout this newscast. You can also find our content on the Tracking COVID-19 page at kpbs.org. In addition to our reporter stories, we are updating our live blog with the latest news and case numbers. For many San Diegans, February rent is due on Monday. Those who have lost income due to the pandemic are living with the stress of losing their homes and businesses. As Metro reporter Andrew Bowen explains, the city is protecting them with a stronger eviction moratorium.
Past eviction moratoriums came with an expiration date that kept getting pushed back as the pandemic dragged on. The measure approved Tuesday has no fixed end date and instead will expire 60 days after the local state of emergency is lifted. Councilmember Vivian Moreno says many businesses are still closed and people are out of work.
Communities in my district like Logan Heights and San Isidro have been some of the hardest hit. So we need to ensure that residents have some security and know that they're not going to lose the roof over their head while we continue to battle this pandemic.
California lawmakers are expected to vote on a statewide eviction moratorium this week that would supersede the local ordinance. But city officials say the local eviction ban is still necessary as an extra layer of protection for struggling renters. Councilmember Joe LaCava says residents and landlords need clarity on what's allowed.
I do ask, as mentioned by in the staff presentation, that we move quickly to provide expanded education and outreach, as well as a legal support system for those who must navigate a difficult bureaucratic system. An ordinance is not enough. People need to know what protections are in place for them.
The council also voted Tuesday to keep the homeless shelter at the convention center open at least through the end of March at a cost of more than $15 million. Keely Halsey is the city's chief of homelessness strategies.
This project, although worthwhile, is expensive. We acknowledge that spending funds on this project creates opportunity costs and that we'll no longer have those funds available to serve other worthy homelessness-related needs.
In addition to the eviction ban and the shelter extension, the city will soon distribute more than $42 million in aid to low-income renters, thanks to the COVID-19 relief bill passed by Congress in December. Andrew Bowen, KPBS News.
And about that California bill that Andrew mentioned, it was passed this week and Governor Gavin Newsom signed it during a special live stream event on Friday morning. San Diego's Tony Atkins, the leader of the state Senate, had this to say.
So we're going to keep working together as a team. We're going to keep working with tenant advocates, other housing stakeholders, our colleagues at the federal level to identify and implement other actions that we can take to help struggling Californians. The Senate's going to continue our ongoing efforts to increase housing supply and reduce housing costs. There are so many things that people have to be concerned about regarding COVID-19. Eviction shouldn't have to be one of those things.
And again,
the bills signed by Governor Newsom extends eviction protections through June as long as tenants pay at least 25% of their rent. Those protections were set to expire this weekend. More than $2 billion in federal funds will go toward rent subsidies to pay past due rent. Now that the stay-at-home order has been lifted, the free pass on parking is ending. Parking rules are now being enforced, and that includes street sweeping restrictions, metered parking, time limits, and yellow commercial zones. There will be a one-week grace period with warnings before the city begins issuing tickets. Also returning to work is the staff at the San Diego Zoo, which will reopen to guests this weekend. Outdoor zoos are allowed to reopen now that the stay-at-home order is lifted. Operations at the zoo will be scaled back with limited capacity. Visitors will need to make a reservation and wear a face covering at all times. SeaWorld San Diego says it also plans to open soon, but no specific date has been set. During the pandemic, food insecurity has grown across the world and here in San Diego. And as our part of our pandemic profile series, KPBS reporter Max Rivlin-Nadler tells us about one Lemon Grove man who was spurred to action.
46-year-old Darnell Williams saw the lines for food distribution growing during the early days of the pandemic.
I was sitting at home during the lockdown, watching the news, and I saw a line of cars at the stadium. And I was wondering what they were there for, and they said the people were there for a box of food.
So, Williams decided to do something about it. Along with some friends, he began collecting food.
And we set up tables in front of my house, and we made handmade signs that said, "Take what you need." And that day, more people came by to take pictures of it than to take food.
But once word began to spread, those in need began to show up. By spring, Williams had moved Take What You Need Tuesdays to the corner of University Avenue and Fairmont Avenue, where it runs from 10 a.m. to 12 p.m. There, people can pick up groceries they need for the week, no questions asked. Williams goes to local grocery stores to spend donated money on the groceries people need.
But it really took me getting out in the community and building a rapport and a relationship with managers at grocery stores to give me a good deal on items and to sell to me. Some of the grocery stores thought that I was a hoarder.
Williams, who worked in insurance before being laid off himself during the pandemic, recalled his own upbringing, dealing with days where his single mother didn't have enough food for the two of them.
As a child, my mom and I found ourselves living on the streets of Los Angeles when I was very young. And there was a time where we needed a program like this, and that program was a no questions asked program that was at a church.
He says they average around 190 households at the distribution site each week. Last week, Williams was honored with the MVP award from the Boulevard Improvement Association.
People that do what I do don't do it for awards. And I told them last night that MVP to me stands for more vegetables, please, because I would rather have a case of canned corn to give out to people than the award. And the award is nice, but
Williams has begun a nonprofit to keep the work of Take What You Need Tuesdays going for as long as possible.
That's why when I look at a young kid coming in with his mom, it reminds me where we were at. And I said, maybe one day this kid will remember this program and help somebody out.
He says people can help support food distribution through Venmo at Take What You Need SD. Max Rivlin-Nadler, KPBS News.
Yet another tool in the arsenal against COVID-19 might be on the way soon. Johnson & Johnson says it will file for FDA clearance for its vaccine in the coming days. The company announced results of its global trial. The vaccine is proven to be 66% effective in most cases and 85% effective in severe cases. While the two existing vaccines require 2 doses, the vaccine developed by Johnson & Johnson requires only 1 shot. Getting shots in arms hasn't been easy locally. Bad weather shut down one of our vaccination super sites this week. And then there's the frustration over supply and scheduling. KPBS reporter Matt Hoffman has more on efforts to improve the process.
We are taking the necessary steps to streamline the process for appointment setting, and this goes hand in hand with the expansion of vaccine distribution and making sure that we have the right infrastructure set as we proceed.
After rainy weather closed the Petco Park vaccination superstation earlier this week, county officials have been working to make up appointments.
I know all of those appointment schedules for those days are being honored.
We saw long lines of cars filled with people eager to get vaccinated. Right now, vaccinations at county sites are only available for those 65 and over, healthcare workers, and first responders.
The biggest complaint we get is people say, I can't get an appointment. And the minute that they are made available, they are gone.
To book an appointment at the downtown location or the superstation in Chula Vista, people have to use the county's website. But for other county-sponsored sites, you have to schedule appointments through the state's myturn.ca.gov platform.
You know, we're doing our best. We're listening, and we're making sure that we are able to adjust these slides as we hear from our communities.
To make it a little easier, soon all testing appointments from a county site will be booked through the state's MyTurn platform. A new vaccination superstation launching this Sunday at Cal State San Marcos in the North County will also use MyTurn.
We will begin taking appointments on Saturday, and we will begin administering vaccines on Sunday.
Some 269,000 vaccine doses have been put into San Diegans' arms so far. There are still some questions about the vaccination supply chain, but officials are moving forward aggressively, hoping to add 6 smaller vaccination pods next month.
And we have to do this all with the presence and awareness that a new, more contagious strain is in San Diego County.
Officials believe a 71-year-old died from a more contagious variant of COVID-19 that's been traced back to the United Kingdom. Some 150 suspected cases of the B.1.1.7 variant have been found in San Diego County.
That's a small number compared to the total number of cases in the county, but we do think that number is increasing, may represent 1% to 2% of all the cases that are out there. The potential impact of that could be seen in a surge later in February and into March.
Transit officials announced that MTS will begin giving free rides to those who can show proof of a vaccination appointment. Countywide, there has been a slight downtrend in hospitalizations and intensive care unit admissions, but those numbers still remain high. And to get out of the purple tier restrictions, we need to see daily case counts go down significantly. Matt Hoffman, KPBS News.
If you want to know just how much progress we're making on vaccinations, go to the vaccination dashboard at kpbs.org. It shows the number of local vaccinations compared to the total population. You can also find a list of vaccination centers. To see the tracker, you just go to the Tracking COVID-19 section at kpbs.org and then click on Vaccines. The vaccine rollout is a nationwide problem. President Joe Biden says the goal is to provide 1 million doses per day. Mandy Gaither tells us how many people have received a vaccine so far.
Between coronavirus vaccinations and natural immunity for those who have recovered from an infection, about 12% and perhaps as much as a third of Americans have some immunity to COVID-19, according to a CNN analysis. But officials urge continued vigilance.
Getting vaccinated does not say now I have a free pass to travel, nor does it say that I have a free pass to put aside all of the public health measures that we talk about all the time.
About 6% of the U.S. population has been vaccinated against COVID-19, according to the latest data from the CDC. While cases across much of the country are plateauing, that's not expected to last. The virus keeps mutating.
What we're now going to see are these new variants, much more infectious viruses, much more easily transmitted, even causing more serious illness, are now going to overlay on top of that very high baseline. So what we can expect to see in the course of the next, I think, 6 to 14 weeks is something that we haven't even come close to experiencing yet.
But health experts say even with the virus variants, there is something that we can do to keep infection numbers down.
The good news is it's still spread by small droplets. It still can be largely prevented by masking and physical distancing.
For Health Minute, I'm Mandy Gaither.
Congressman Darrell Issa was back in North County this week. It was one of his first trips back to his new district. As Jacob Ayer reports, Issa got a behind-the-scenes look at how Palomar Medical Center is dealing with COVID-19.
It looks like a field hospital.
Yeah. Congressman Darrell Issa took a tour of the 11th floor at Palomar Medical Center Escondido to see what an overflow room for incoming patients would look like at the facility. The 10th floor of the building is currently stationed with 100 hospital beds and is being used to care for 18 patients with COVID-19. It is the only alternate care site located in San Diego County.
We saw warm beds that are available for further surge if needed, that have been prepared, that give us some relief. What we also saw was the strain on the actual intensive care facilities, particularly those which are designed with negative pressure.
The 2 floors of alternate care sites were first set up in the spring of 2020 by the National Guard to help deal with the overflow of patients due to COVID-19. Palomar Health CEO Diane Hansen says the 11th floor is currently not in use.
We were originally issued regular cots, a normal cot that you would see in a field hospital. And the state rallied and actually gave us actual patient beds, just an open air unit, but it does have dividers. It has actual patient beds and all the equipment that is needed up there to take care of the patients.
Issa was impressed by the setup, but worries that the county, state, and federal government have not paid for the $3.5 million of expenses for new facilities and staff at Palomar Health's Escondido site.
Hospitals have to have the confidence that when they do something when asked, that they won't be doing it to the detriment of their own financial ability to pay other bills and treat their other patients.
Hansen says the pandemic has stressed hospital staff, but Palomar Health has added nurses and ICU beds to their facilities. Jacob Ayer, KPBS News.
Poway Unified is going forward with bringing some students back to campus. Starting on Monday, elementary and special ed students will return to in-school learning. Students choosing to stay home can still receive online learning. The district says the state is requiring it to hold back on middle and high school students returning until the county is in the red tier. UC San Diego had a surge of COVID-19 cases among students returning from their winter break, but new cases have dropped dramatically in recent weeks. KPBS education reporter Joe Hong explains how the university is hoping to keep it that way.
With about 10,000 students on campus last quarter, UC San Diego kept COVID-19 case numbers low through the end of 2020. But after the winter holiday, cases spiked among students, with more than 200 reported during the first week of the new quarter. Robert Schooley is a professor of medicine at UCSD overseeing the university's COVID strategy.
Well, we anticipated this would happen when people go home and mix with multiple generations and see their high school friends and socialize. This virus takes advantage of that.
But in less than 2 weeks, numbers have plummeted back down to single digits thanks to the testing and quarantine program the university had in place since last year.
We had prepared for it by doing a number of things. We had surge testing, if you will, during that first week to try to identify as quickly as we could people upon return who had brought the virus back with them.
UCSD has reported 861 cases among students since the onset of the pandemic and 331 since the beginning of the school year. Schooley said even at its peak, the university easily managed the surge in cases. The campus had plenty of quarantine rooms available for students testing positive.
No, we never got up to any more than about 180 beds, and we have 600. So we could have handled many more than that. We really always wanted to have a big buffer in terms of quarantine beds.
Looking ahead, Schooley said his team is now focused on avoiding another surge after spring break. He said the university is designing spring break internships so students can remain on campus building their resumes instead of traveling.
Our goal would be to create a number of really interesting career development pathways and things that they don't have time to do during the class year and the school year, and try to see if they can stay on campus and not have to go off campus and come back and surge back with the virus.
Schooley said unless there's a significant delay, he expects the university to be close to fully reopen in the fall. Joe Hong, KPBS News.
One of San Diego's marquee sports events is happening this weekend just without fans. The Farmers Insurance Open is being played at Torrey Pines, and it features the stars of the PGA Tour, including San Diego's Phil Mickelson. One notable exception is Tiger Woods, who is out with an injury. The PGA is planning to hold one of its major tournaments, the U.S. Open, at Torrey Pines in June. And here's a glimpse into a COVID-free future. In Australia, thousands of fans are in attendance for the start of the Australian Open this weekend, mostly without masks. This is one of the biggest tennis events of the year. Serena Williams and Naomi Osaka are among those taking part. All players had to spend 14 days in quarantine upon arrival. Australia has had nearly 2 weeks without any cases in its states or territories. And we end this show with a trip back to the start of the pandemic. 1 year ago, all eyes were on Wuhan, China. David Culver shows us how the city and its people are trying to move forward.
It is a city whose name evokes mystery, allegations of cover-up, and agony. Wuhan, China. CNN returning to this, the original epicenter of the coronavirus outbreak. On January 23, 2020, this metropolis of more than 11 million residents locked down. We left hours before, beginning a 2-week quarantine in Beijing. For 76 days, Wuhan remained sealed off.
And here we are again, back 1 year later, the Huanan seafood market. This at one point was believed to have been, by Chinese authorities, the ground zero of this outbreak.
This time last year, security had ushered us away within minutes of reporting.
Now, January 2021, no security here. We've been walking around for several minutes. They don't seem to care.
That was until we started looking inside. We noticed some people working behind the gate. Suddenly, a seemingly random passerby on a bike shouted at us, saying, "Don't be sneaky." He later identified himself vaguely as working for the government. He told us to walk around and try the entrance.
Can we go in?
We can go in that way. He said apparently we can go in, so we'll see if we can actually get inside the market.
But I'm going to ask this guy, can you go in? You can't go inside? Oh, tell him we have a COVID test, a negative COVID test.
Okay, you just can't get it.
You can't get?
Don't take the pictures.
Okay, no pictures.
Yeah.
So clearly a bit sensitive. Perhaps it's because we're foreigners or because we're journalists.
The virus's origin has become highly politicized. U.S. officials accusing China of covering up and allowing the virus to spread. China defensive, saying the Trump administration was deflecting blame for its own mishandling. A team from the WHO is now in Wuhan, tasked with trying to find out the truth. And yet, geopolitics aside, the human suffering, it is universal. Young Min spoke with us knowing she could face pressures from officials, but a mother who's lost her only daughter has no more to lose.
When I sat down, you thanked me for getting the truth out. What is the truth as you know it?
The local officials did not tell us about the pandemic, she said. If measures were taken, I would not have sent my child to the hospital, which was the source of the infection. Last January, Young's 24-year-old daughter had been receiving treatment for cancer. She contracted COVID-19 and died in early February. When I speak about this, some parts of my heart still ache, she said. Amidst the deep pain, we also encountered moments of hope in our return. On the eve of the lockdown last year, we visited this fruit market. This woman selling sugarcane told me at the time that she was terrified. She stayed, fearing the financial burden. 12 months later, we met again. At that time, I was crying all the time, she told me. We were suffering and scared. Above her face mask, the pain still visible in her eyes. She says the people of Wuhan are resilient, likening them to heroes.
I'm so glad to see you in person and to know that you made it through the lockdown and you're healthy.
The market mood remarkably different from last year. Business bustling, people much more at ease.
Would you say Wuhan is back open and on the path to recovery?
It's not just starting from now, he says. It started very early, to be honest. In my opinion, Wuhan had already begun to recover since mid to late March. Delivery driver Lao Ji has become well known on Chinese social media as he chronicled life during the lockdown. The then and now are striking. A city desolate amidst the lockdown, followed by a summer with packed pool party images that shocked a socially distanced world outside of China. And a New Year's celebration that brought Wuhan residents shoulder to shoulder. Though with new cluster outbreaks in the north of China, many here in Wuhan once again wearing face masks, cautious of the lingering unknowns, and still surrounded by the haunting memories of a lockdown that kept millions of residents, along with their grief, sealed inside. For some, only now, 12 months later, it is just beginning to surface. David Cover, CNN, Wuhan.
And you can follow our COVID-19 coverage anytime at kpbs.org. Just go to our homepage and click on the Tracking COVID-19 link. We have all of our reporter stories along with updates to our live blog with the latest news and case numbers. And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and from all of us here at KPBS, thanks for joining us and stay safe.